I'm earnestly grateful to the Thalassaemia International Federation for allowing us to share our story at this prestigious international forum. My narrative is not just my own. It encompasses the collective journey of my family, countless patients from across Pakistan, and our relentless struggles. As you've learned from my introduction, I'm a 35-year-old individual living with thalassaemia major in Pakistan. My journey commenced in 1987 when I was diagnosed with this condition at the tender age of 6 months. In those years, thalassaemia awareness was virtually non-existent in our country, and there was little understanding of the significance of premarital or prenatal tests. Before my arrival, my parents had 3 children, 2 of whom were affected by being thalassaemia major, while my other sibling was unaffected. The diagnosis came relatively easy for the doctors, and I received my first blood transfusion at the age of 6 months. During that period, there was only one thalassaemia center in Pakistan, where my siblings and I received our regular transfusions. However, due to the lack of awareness about standard treatment protocols, such as iron chelation, we were only receiving transfusions without the necessary additional care. Our family was unaware of the critical importance of iron chelation and its role in maintaining hemoglobin levels. Regrettably, this lack of understanding led to the tragic loss of our elder brother, Noman, due to complications arising from an enlarged spleen and iron overload. This devastating event profoundly impacted me and my other sibling, Salman, who also lived with beta thalassaemia major. In a desperate bid to find a solution, my parents explored into the possibility of a bone marrow transplant. However, despite our efforts, we faced numerous setbacks, including the inability to find suitable donors and logistical challenges that prevented us from undergoing the transplant procedure in India. During our time in India, we immersed ourselves in learning about thalassaemia, its recommended treatments, and the importance of awareness. Upon returning to Pakistan, we took the initiative to create the first ever thalassaemia awareness portal in the country in the year 1999. Through our website, we provided vital information, guidance, and support to those within our community grappling with the same condition. Despite the heartaches, we endeavored to live a life as close to normal as possible. We shifted to a better equipped hospital, but tragedy struck again, in 2009 when we lost Salman to meningitis. In the wake of his passing, I assumed the mantle of his initiative, FAiTh, Fight Against Thalassaemia. Today, our Registered Patient Parent Association in Pakistan offers free medicines, consultations, awareness, treatment programs, and empowerment opportunities. From blood transfusions to medical sponsorship programs, and from awareness sessions for patients and parents across Pakistan to collaborative efforts with donor agencies, we are striving for establishment of a drug donation society. As active members of the Thalassaemia International Federation and the Thalassaemia Patient Advocacy Group, we are currently working towards establishing Pakistan's first dedicated iron chelation center. We are putting in concerted endeavors through social accord and corporate support in the form of empowerment programs for chronically sick patients, legislative pursuits at government level, and assisting Thalassaemia Federation of Pakistan towards achieving a thalassaemia-free Pakistan. Allow me to share a recent deeply poignant incident from my life. Just days before this conference, a sudden health crisis left me breathless and in an emergency situation. With a saturation level of as low as 60, some medical professionals expressed concerns about the possibility of a pulmonary embolism. The lack of proper treatment options and diagnostic facilities in Pakistan compelled me to seek medical advice from professionals abroad. Because of the prolonged process of diagnosis and treatment, I find myself unable to join you in person. Hence, I requested Tiff to share my journey with you. However, the plight of thalassaemia patients in Pakistan continues to trouble me deeply. Even after more than 3 decades, the standards of treatment, proper iron chelation facilities, and safe blood transfusions remain inaccessible. Our fellow patients are grappling with additional complications such as hepatitis and HIV, while many lose their lives due to experimental treatments and a lack of adequate medical resources. The road ahead for thalassaemia patients in Pakistan remains challenging, and achieving the healthcare standards that other countries have attained feels like a distant goal. Thank you for allowing us to share our journey, and we hope that our story serves as a testament to the ongoing struggles faced by thalassemia patients in our country and beyond. Ayesha Mehmood.